Hi, this is your Sussex County chiropractor, Dr. Will Holdsworth from Pain Relief Chiropractic. We're on video 4, the last video of heat or ice. Now this video is going to include both heat and ice. This is something that I'm going to describe called contrast therapy. It's a pretty cool idea. So what you do is you put ice on an area and then heat on an area. Ice on an area and heat on an area, and going back and forth with those temperature extreme differences, what's going to actually happen inside your body is your blood vessels are going to vasodilate and vasoconstrict. So vasoconstriction is where they tighten up and get small. That's what ice does to your blood vessels to try to, protect your body. And then when you use heat, it expands the blood vessels, vasodilation, so that you can have the heat transferred out, so you don't get too hot in one area and you don't get too cold in an area. That's how that works. So what you do is you put the ice on for 10 minutes and then you put the heat on the same area for 10 minutes right after that. Ice again 10 minutes, heat 10 minutes. So 40 minutes total, and try that out to pump out any sort of inflammation. Now remember, I talked about inflammation and how it is actually a good thing because there's healing factor in there. If you missed that, go to video 2. You don't want to get rid of inflammation completely for an injury because that it has all the healing factor and that's going to cause a problem. You want to make sure you keep the healing factor in there. But if you have inflammation that's out of control and you need to control it somehow, get it to go down a little bit, this is the best thing you can do. Just do the contrast therapy. So if you have any questions about that, go ahead and ask me. Otherwise, thanks for watching the 4 video series. I'm Dr. Will Holdsworth from Pain Relief Chiropractic, your Sussex County chiropractor.